Welcome. Today, we have a deep dive, custom tailored specifically for you.
We really do.
Yeah, looking at the fascinating stack of sources you sent over. Our mission is to explore a corner of medicine that, well, it usually stays hidden behind closed clinic doors.
Right, but it's rapidly becoming this highly commercialized industry.
Exactly. So we are going to demystify two of the most heavily marketed non-surgical intimate procedures available today, the O shot and the G shot.
And it is a topic surrounded by just an immense amount of confusion.
Oh, totally.
Because, these procedures sound so similar, and they're often sold in the exact same glossy clinic brochures.
Right, right.
So patients frequently assume they are essentially the same thing, just different flavors of a quick, intimate fix.
But as your sources reveal, they represent two entirely different biological universes,
Completely different.
which is exactly the core question we need to answer today. What is the fundamental difference between the G shot and the O shot?
Yeah, because they use different mechanisms, target totally different issues, and even carry their own trademarked controversies.
Okay, let's unpack this. To really understand what these shots do, we first have to look at exactly what is inside the needle.
That's the best place to start.
Right, so let's start with the O shot, which that stands for the orgasm shot.
Yeah, and the primary ingredient in the O shot isn't manufactured in a pharmaceutical lab at all. It actually comes from the patient.
Wait, from the patient themselves?
Exactly. The procedure relies on platelet-rich plasma, or PRP.
Okay.
It begins with a standard routine blood draw from the patient's arm.
Just like getting blood work done.
Right, exactly like that. And then that vial of blood is placed into a centrifuge.
Okay.
By spinning the blood at extremely high speeds, the machine separates the red blood cells from the platelets and the plasma.
Oh, wow.
Yeah, so it isolates this highly concentrated yellowish serum that a lot of clinics, well, they like to market it as liquid gold.
Liquid gold. That visual is kind of wild, but it highlights a really important medical distinction here.
It really does.
Because it uses your own blood,
Yeah.
the sources refer to this as an autologous treatment,
Right.
which basically means your body instantly recognizes it. You aren't introducing a foreign chemical, so the risk of an allergic reaction, or like tissue rejection, drops to virtually zero.
Yeah, and that safety profile is a major selling point. But the real science lies in what those concentrated platelets actually do.
Right, the mechanism.
Exactly. Platelets are the body's natural first responders. Like when you cut your finger, platelets rush to the site to stop the bleeding and initiate healing.
Okay, I'm with you.
So when they are highly concentrated and injected into a specific area, they release this cascade of really powerful growth factors.
And the sources mentioned a few of these by name, using some heavy acronyms like VEGF and PDGF.
Yeah, there's a lot of alphabet soup there.
Right, but I want to break down how they actually function, rather than just reading a textbook. These growth factors essentially act as biochemical messengers, right?
That is a great way to put it. They are signaling proteins.
Okay.
One of their primary jobs is to target endothelial cells, which are the microscopic cells that line the inside of your blood vessels.
Oh, interesting.
Yeah, so the growth factors hand these cells a blueprint, instructing them to start a process called angiogenesis,
Which means making new blood vessels.
literally creating brand new blood pipelines. Yeah. And at the same time, they stimulate local stem cells to regenerate nerve endings and produce fresh collagen and elastin.
Wow.
So you are fundamentally commanding the tissue to rebuild and revitalize itself at a cellular level.
So, if I'm understanding this right, the O shot is basically like planting seeds and adding high-grade fertilizer to grow entirely new, healthy tissue over time.
Exactly.
But if we contrast that with the G shot, which stands for G-spot amplification, the ingredient list here abandons cellular regeneration completely.
Yeah, completely different approach.
The G-shot uses standard dermal fillers. The historical sources mention collagen, but modern clinics typically use hyaluronic acid-based fillers.
Right.
And that's like the exact same manufactured gel you'd find in brands like Juvederm or Restylane, used for plumping lips or smoothing wrinkles.
Exactly the same stuff. And I mean, hyaluronic acid does occur naturally in the body as a substance that binds to water.
Sure.
But in the context of the G-shot, we are talking about a manufactured, highly viscous gel being introduced into the tissue from the outside.
Which means if the O shot is seeds and fertilizer, the G shot is essentially like lip filler, but placed inside the vaginal wall.
That is a perfect analogy. What's fascinating here is how fundamentally different these approaches are, despite sounding so similar to a lot of people.
Yeah.
The O-shot attempts to heal, rebuild, and restore vascular function from the inside out.
Right.
But the G-shot, it doesn't heal anything at all. It simply adds physical volume and structural prominence to create more surface area and friction.
And friction is kind of the operational word there.
Yeah.
Because we are dealing with such radically different ingredients, regenerative serum versus physical gel, the placement of the needle and the timeline for results vary wildly.
Huge variations, yes.
For the G-shot, the geography is hyper-specific.
It has to be. Since the goal is purely mechanical friction, the filler's injected about 2 inches deep into the anterior vaginal wall,
Right.
directly into the Grafenberg spot, which is commonly known as the G-spot.
And there's a really vivid detail from the 2007 San Francisco Chronicle article you provided in the stack.
Oh, yeah, I know the one.
It describes a doctor using a 3.5-inch needle to pump that collagen into the G-spot, making the internal area physically swell up to the size of a quarter.
Yeah, that imagery is intense, but the goal is literal physical amplification.
Right.
By creating that localized quarter-sized bump, you are physically protruding the tissue, making it far more likely to be stimulated during penetrative sex.
Okay, so that's the G-shot, and the O-shot takes a much more expansive approach to the geography, right?
It does. The PRP serum is divided and injected into 2 separate locations.
Okay, where?
The clitoris itself and the anterior vaginal wall near the G-spot.
I mean, I imagine the thought of a needle near the clitoris might make anyone listening wince.
Oh, absolutely. It sounds terrifying.
But the clinic FAQs are very clear on the pain management. They use highly potent local numbing creams and sometimes local anesthetic injections prior to the actual procedure.
Right.
So patients consistently report that it is virtually painless, feeling perhaps a slight pinch with the whole injection process taking less than 30 minutes.
The numbing protocols are quite robust, but, the real divergence between the 2 procedures happens after you leave the clinic,
Okay.
and it comes down to how these substances behave over time. The G-shot offers immediate gratification.
Because the filler is physically there right away.
Exactly. The physical filler creates that quarter-size volume instantly. However, because it is hyaluronic acid or collagen, the body will naturally metabolize and break it down.
Just like lip filler fades.
Exactly. The sources note it typically only lasts about 3 to 6 months.
Though some aggressive marketing claims up to 12.
Right. But realistically, 3 to 6 months before the filler simply dissolves and the bump completely disappears.
Whereas the O-shot requires serious patience. It's a game of delayed gratification.
Precisely. Because you are relying on biological regeneration, it takes time for your body to execute those blueprints we talked about.
Right.
You might feel some initial sensitivity due to the fluid volume, but it takes 6 to 12 full weeks for the body to actually grow those new blood vessels and nerve endings.
That's a long wait.
It is, but the trade-off for the wait is longevity. Because you've grown actual new tissue, rather than just inserting a temporary gel, the results last much longer.
Like how long?
Typically 12 to 18 months, and frequently even longer than that.
Which brings us to a really counterintuitive detail in your sources regarding the post-procedure rules.
Ah, yes.
Specifically, the rules of abstinence.
Yeah, this surprises a lot of people.
If you get the O-shot, which involves multiple needle punctures, including the highly sensitive clitoris, you only have to abstain from sex for 24 hours.
Right, just enough time for the tiny injection sites to seal up against bacteria.
But for the G-shot, which is just injecting filler into the vaginal wall, patients are strictly told they must wait 3 to 5 days before having intercourse.
It seems backward, doesn't it?
It really does.
Yeah.
I mean, you'd think the blood-drawn, multi-site injection would require more downtime.
You would think that, yeah.
But if I think about the physics of the filler, hyaluronic acid right out of the syringe is malleable.
Yes.
It's basically like wet clay. It needs time to integrate into the surrounding tissue and firm up.
You've hit on the exact mechanism there. In cosmetic medicine, this concept is called migration.
Migration, okay.
Right. If a patient engages in penetrative sex too soon after a G-shot, the sheer physical friction and pressure can literally push that wet clay out of the intended spot.
Oh, wow.
Yeah, you could end up shoving the filler away from the G-spot entirely, causing asymmetrical lumps or bumps in areas where you really don't want them.
Yikes.
Yeah, you have to wait for the clay to set.
Migration of vaginal filler is not a concept I ever thought I'd be exploring today, but the physics dictate the rules.
They do.
Now, while the G-shot has the strict friction ban, The O shot has a massive, absolute warning regarding medication.
This is so important.
If you take the O shot, you cannot take NSAIDs like ibuprofen, Aleve, or aspirin for 7 days before or after the procedure
Yeah, and this is a vital biochemical rule that ties directly back to how the shot works.
because of the platelets.
Exactly. NSAIDs are designed to reduce inflammation, but their mechanism of action involves inhibiting certain enzymes that affect your blood platelets.
Okay.
So if you take an ibuprofen, you are chemically deactivating your platelets. They essentially go to sleep.
Oh, I see.
If a doctor draws your blood and spins it while your platelets are deactivated, they will not release those crucial growth factors when injected.
So you've essentially just injected expensive, useless fluid into yourself and completely ruined the regenerative process.
Exactly. You've totally wasted the procedure.
That is a critical operational detail for anyone looking into this. So looking at the underlying biology, the regenerative tissue growth versus the physical wet clay filler, it completely dictates who these treatments are actually for.
They serve radically different purposes.
Right.
The O-shot has surprisingly broad clinical applications that go far beyond just enhancing sexual pleasure.
Because of the tissue repair.
Exactly. Because it fundamentally improves vascularity and thickens tissue, gynecologists use it to treat genitourinary syndrome of menopause, or GSM.
Which is?
It's a condition that causes severe, painful thinning and drying of the vaginal walls as estrogen drops.
Okay, that makes sense.
It is also used to treat dyspareunia, which is chronic pain during sex.
And the sources even point out its use as an adjunct treatment for lichen sclerosis,
Right.
which is a chronic inflammatory skin condition that can severely scar and damage vulvar tissue.
Yeah, the anti-inflammatory and regenerative properties of the concentrated plasma can really help manage that tissue damage.
Wow.
But perhaps one of the most common medical non-sexual uses for the O-shot is treating stress urinary incontinence.
Let me stop you there, because that's the leaking that happens when someone laughs, coughs, or sneezes.
Right.
How on earth does an injection of plasma into the clitoris and vaginal wall fix a leaky bladder?
It's a matter of structural engineering within the pelvis, really.
Okay, explain that.
Well, the urethra and the bladder sit right against the anterior vaginal wall.
Okay.
In many cases of stress incontinence, that vaginal wall has thinned or weakened and is no longer providing a firm backing.
Right.
So when the O-shot stimulates new collagen and elastin production in that specific wall, it physically thickens and tightens the tissue.
Ah, I get it.
Yeah, that rejuvenated, thicker tissue then acts like a stronger, firmer hammock.
A hammock for the bladder.
Exactly. It provides better physical support to the urethra, preventing the involuntary leakage when abdominal pressure spikes.
I see the connection now. It's a holistic structural restoration of the pelvic floor.
Exactly.
But the G-shot, conversely, has a singular, hyper-specific focus.
Very singular.
It does not treat sexual dysfunction. It does not treat low libido. It doesn't help with painful sex. And it certainly doesn't support the bladder.
Not at all.
It is purely designed to increase the physical surface area of the G-spot to create more friction during penetration. Period.
Yeah, it is a cosmetic enhancement for a functional purpose, but it is in no way a medical restoration. And the medical community stresses very important caveats for both of these procedures.
Yes, the American Society of Plastic Surgeons issued a very clear warning in the provided guidelines.
Which is?
Neither of these shots is likely to help a woman who has never achieved an orgasm.
Right.
You can't amplify a neurological pathway that hasn't been mapped out yet. Injecting plasma or filler is not a magic switch that will suddenly create a complex psychological and physiological response from scratch.
That is a crucial boundary to set regarding patient expectations.
Absolutely.
Furthermore, the clinical literature notes that the O-shot is not a simple fix for PGAD.
That's persistent genital arousal disorder, right?
Yes. PGAD involves unwanted, intrusive, and often highly distressing genital sensations.
So adding more nerve growth there.
Exactly. It requires incredibly careful, specialist neurological and pelvic floor assessments. Throwing a regenerative serum at hyperactive nerves without understanding the root cause could be completely unhelpful or even exacerbate the issue.
Here's where it gets really interesting.
Oh, yeah.
Because everything we've discussed so far assumes we are just talking about generic medical science.
Right.
But we aren't. We are talking about highly commercialized registered trademarks that exist in a very specific and highly lucrative cultural moment.
The commercialization is a massive part of the story. These are not just generic surgical techniques that any doctor reads about in a textbook and performs at their own discretion.
Right.
They're branded intellectual property.
Dr. David Matlock actually invented and trademarked the G-shot back in 2005. And the journalistic dive you shared notes, he was charging around $850 for the procedure, and he literally built a franchise model.
A physical franchise model, yeah.
He sent out physical kits to other doctors that included the specific collagen dosages, those intimidating 3.5-inch needles, and a 30-minute instructional DVD.
And similarly, Dr. Charles Runels trademarked the O-shot.
Right.
He published the first peer-reviewed description of using PRP for female sexual dysfunction in 2014, and he strictly licenses the O-shot name.
So not just anyone can offer it.
Exactly. Providers actually have to pay fees and undergo training with his specific organization to legally use the marketing term.
Interesting.
He argues this licensing is absolutely necessary for quality control, to ensure providers follow his exact specific protocol, like guaranteeing the clitoris is injected and not just the vaginal wall.
It's a fascinating business model built entirely around intimate health.
It really is.
And the San Francisco Chronicle article provides such a vital sociological lens on this. We have to look at the cultural controversies surrounding the medicalization of the bedroom.
Yeah, if we connect this to the bigger picture, sociologists point out that we are currently navigating what is often called a post-Viagra world.
So, meaning that once there was a highly effective pill to chemically fix male mechanics, society suddenly expected female biology to work with that same push-button efficiency.
That is the exact paradigm shift.
Oh.
The introduction of Viagra fundamentally altered cultural expectations around sex and aging. It created an expectation of mechanical perfection, readiness, and longevity.
Right.
While it started with men, that immense cultural pressure cascaded. There's now an expectation to maintain a dynamic, perfect, effortlessly attainable sex life well into later decades.
And psychiatrists like Lenore Tiefer, who founded the New View campaign, are pushing back incredibly hard against this trend.
Yes, she is very vocal about this.
Her argument in the sources is that we are actively pathologizing perfectly normal human variations.
Tiefer's perspective is that fluctuations in desire are normal.
Right.
Things like mismatched libidos between partners, general fatigue from life, or simply needing more time and foreplay to warm up used to be viewed as normal relationship dynamics. They were addressed by couples therapy, better communication, or introducing sex toys. Now, those same normal variations are being labeled as medical dysfunctions that require a $2,000 surgical injection to cure.
It's the insidious idea that if you aren't having mind-blowing, effortless orgasms on demand, there must be a biological flaw inside of you that needs to be cosmetically augmented.
Right.
It capitalizes heavily on deep-seated insecurities.
It creates an entirely new, highly commercialized standard of what good sex is supposed to look like.
Yeah.
And this fierce cultural debate is heavily compounded by a glaring evidence gap in the scientific literature.
This part is wild to me.
The broader medical establishment remains highly cautious about these specific branded procedures because there is a severe lack of double-blind, placebo-controlled studies.
Which is the absolute gold standard of medicine.
Absolutely.
Give half the study group the real shot, give the other half a fake water shot, and objectively track who actually improves.
Right.
But Dr. Matlock, the G-shot inventor, flat out refused to perform a double-blind study.
And his reasoning is entirely based on the physical mechanics we discussed earlier. He argued that a placebo water injection wouldn't work as a blind test because the patient can physically feel the outcome immediately.
That makes sense, actually. If a doctor injects sterile water into the vaginal wall, the tissue just absorbs it.
Yeah.
But if they inject thick hyaluronic acid, it creates a quarter-sized lump. The patient instantly knows if they received the real drug or the placebo, breaking the blind entirely.
Precisely. Matlock claimed an 85% success rate in his own internal pilot study, but refused to publish the raw data for peer review, citing the impossibility of a blind test. So researchers are left frustrated, saying, we cannot scientifically validate these claims without rigorous blind studies, while the inventors counter with, a blind study is physically impossible here. Just look at my clinic full of happy patients.
It leaves the everyday consumer in a really tough spot.
It really does.
You are forced to navigate slick marketing campaigns, genuine biological science, and a complete lack of rigorous academic consensus.
Yeah, you're kind of on your own.
So what does this all mean? We've covered a massive amount of ground today.
We have.
To bring it all home, the O-shot is a regenerative, holistic approach. It utilizes your own blood's growth factors to slowly rebuild tissue at a cellular level, improve blood flow, and treat a wide variety of both medical and sexual issues, from stress incontinence to painful sex.
And the G-Shot is a targeted, localized cosmetic approach. It uses manufactured filler to instantly, but temporarily, enhance the physical surface area of the G-spot to create more friction and pleasure during penetrative sex.
They both offer exciting possibilities for women who are feeling frustrated, experiencing pain, or simply feeling disconnected from their bodies.
Right.
But they are medical tools, not magic wands. And I want to leave you with one final, slightly provocative thought to mull over that builds on everything we've explored.
I think I know where you're going with this. It's the psychological component of these procedures.
Exactly. Imagine a woman gets an O-shot or a G-shot. She has just spent a significant amount of money and time.
Right.
As a result, she is now hyper-focusing on her anatomy. She is actively tracking her arousal. She's likely communicating more openly with her partner about what she wants. And she is eagerly anticipating a dramatic improvement in her sex life.
The psychological priming there is absolutely massive.
So the question for you to explore is this: how much of the resulting pleasure is purely a biological response to PRP tissue regeneration or physical filler friction?
Yeah.
And how much of it is actually the profound, scientifically proven psychological power of the placebo effect?
That's a huge question.
How much of the cure is simply the act of taking action, giving a woman renewed confidence, shaking up her routine, and granting her the mental permission to simply relax and enjoy sex again?
It's a fascinating gray area where cold, hard biology and complex human psychology meet.
It really is. Thanks for diving in with us today.